For Australian Health Week, everybody had to, of course, pre-register for the event. So as you walked in and out, everyone was scanned. So it was very clear about the contact tracing would all be possible. There was lots of hand sanitizer around, and there was also a few people still wearing masks. But in general, it felt pretty normal, to be honest. It's only natural that the impact of the last 12 months on the health industry has caused people to look at things like remote healthcare, telehealth, how that can be implemented, what sort of technology is required to make that possible. The new technologies that are being implemented are enabling clinicians, nurses, all of the people who need to deal with a patient, they're enabling them to do their job wherever they are. Remote technology, the ability to be able to stay at the patient's bedside if it's in a public hospital setting by having a remote device in their hand, rather than having to go away to a workstation and come back and all of that information. I think those sort of technologies are where the real change is happening, and particularly, again, in remote and telehealth, that ability to be able to provide healthcare at a level that's equivalent regardless of whether you're face-to-face or whether you're in a more remote setting. Healthcare devices are coming in all shapes and sizes. They're all connected to networks, and they all have to be secured if they're going to be allowed to be on a hospital's network, or even if they're going to be allowed to have access to information about patients. So the role that SOTI's playing in deploying, securing, updating, managing devices of all sorts of operating systems, Windows, Android, iOS, even printers in the health environment, that role that SOTI has is a really significant one.